Hello, everybody. Welcome to today's webinar on behalf of the National Colorectal Roundtable, the Evaluation and Measurement Task Group. I'm Andy Dwyer, one of the co-chairs of the group, and on behalf of the entire NCCRT, my colleague April Berry, and Mary Dorshinkin team, we want to welcome you to today's webinar. So we're super excited. As I understand that we have over 200 plus people who are registered for evaluation, webinar, discussion. Woohoo! Very, very excited. So super excited that people are as excited about the evaluation tools that we're developing as we are. So just want to go ahead and get started with all of you this afternoon and welcome you. For today, the purpose of our webinar is to really talk about what's been developed in terms of our evaluation toolkit. And many of you familiar with the webinar are speaking of the toolkit as a fundamental stepping stone in terms of understanding evaluation, with really thinking of the key 7 activities. But over the last year, we've done a dedicated attempt to make sure that we're really getting into what are the fundamentals of evaluating the specific interventions that are critical to increasing colorectal cancer screening and awareness, using those fundamentals from evaluation, but now actually improving a lot of that work with case studies, specific tools, activating in terms of thinking about how do we activate providers, implement policy change, and implementing system change. And thinking in our quest to reach 80% by 2018, how will we really look at those strategies to increase awareness activities and be able to evaluate to know that we are making the proper gains that we want to reach our the 80% by 2018 goal. So very excited about what we're developing and talking about today with all of you. And as noted, we're going to be able to really delve into a lot of specific interventions with these new tools, case studies, and very specific examples to show how can you truly evaluate this work based on the fundamentals. So I'm very excited that in terms of really looking at our team, we have a bunch of fantastic presenters today in terms of the people who've made fantastic contributions to the evaluation toolkit, with Heather Holmes, who's our friend from Wilder Research, Amanda Haynes, who's also part of the Wilder team, and Dr. Heather Duckett out of the New York State Department of Health and their work, as well as Heather Brandt and myself in terms of thinking about different health promotion activities. So we're really excited to not only talk about the very key fundamental activities of evaluation, but also really get some real-world examples from people in the field about how they're evaluating their specific endeavors to reach this 80% quest that we're all embarking upon. So very excited to have all of you joining today. Just a quick bit of information is that we're really thinking about the contributions that CDC as well as the American Cancer Society and our roundtable members have made in terms of thinking about pulling together these resources and information and the content. So we just want to remind everyone that we do rely on great support from CDC as well as the others throughout this quest for really creating good quality materials. And we're wanting to make sure that in terms of keeping it good content and great information, that the insight and careful review of all of our partners is definitely critical to this information. So we're really going to hear from a lot of our case presenters today about community endeavors, about navigation programs, as well as thinking about new case studies around policy change that has been implemented. Again, but without this key funding as well as the contributions from our partners, we wouldn't be able to do this great work. So in terms of further noting that our evaluation examples and contributors, we really want to thank also a lot of the folks who've been individually involved in the efforts. And the slide that you see now are people who've made contributions to the toolkit overall, as well as our very fantastic efforts in terms of really evaluating the 80% by 2018 campaign. So as you can see, we're talking about a lot of different folks who've been very involved. So huge thank you to all of those who really helped pull this together. With a special recognition for the Wilder team for being with us from the beginning of this development of this toolkit and really building on that foundation to make what it is today. So I really want to take a little bit of time just quickly to a few couple of housekeeping items to share, just to make sure that we are recording today's webinar. So in terms of having that replayed in the next day or two, Mary Dorshinkin team will make sure that that's available. You should have received an email from Mary earlier today with speaker slides and links to updated the evaluation toolkit. If you didn't get those, we will be definitely circulating those again. And because of the large number of participants that are participating today, we want to encourage you all to use the Q&A function, and I think several of you have actually been able to find that already down at the Q&A section. So type any specific questions that you might have related to today's content, and we'll make sure to dedicate the entire hour to presentation, but also 15 minutes to really hearing out those questions and being able to discuss that with our key experts and presenters. So if you also have any specific audio-visual issues today, make sure and go ahead and type them in as well, and Vanessa, our fantastic operator, will be helping us in terms of facilitation of the audio-visual portion of the show as well. So in terms of anything that we don't get to today, we will also go ahead and make sure to email any of those pressing questions if we do have an overwhelming number of questions that come through. And, of course, the evaluation of this webinar, because it says webinar about evaluation, is critical. So we want to make sure that at the end of this, that you also give ample time and consideration to what went well, what you think of the tool, as well as what you think we could improve or what's needed in the future. Or if you want to just give us a big, hey, shout out, that was fantastic, that's much appreciated as well. So with that, I would actually like to first welcome over to Amanda and to Cheryl, who are part of the research, the Wilder Research Group. We're going to really start to unpack the goals and really the initiative that the toolkit really helps to embrace in terms of evaluation. So I am going to go ahead and turn it over to you ladies, and I think we are ready to go. So Amanda and Cheryl, you are up.
Great, thank you, Andy. This is Cheryl Holm-Hansen from Wilder Research, and on behalf of my colleagues, we're happy to be participating in the webinar today. As Andy mentioned, we have been partnering with the National Colorectal Cancer Roundtable since the beginning of this evaluation project and the production of this toolkit, which is now in its 4th updated edition. To start, we just want to give you a little bit of background about Wilder Research and who we are, and then we will talk about the toolkit. Wilder Research is a division of the Amherst H. Wilder Foundation. We are located in St. Paul, Minnesota, and we operate under a mission to improve the lives of individuals, families, and communities through social research and program evaluation. Some of our work is used by local agencies, by schools, nonprofits, foundations, health systems, and others to understand community trends, to measure program effectiveness, identify needs and solutions at the policy, community, and program levels, and to build increased public awareness of issues. One of the things that we do a lot is try to build evaluation capacity, and that's really the background for this toolkit, which is designed to be a resource for community programs who want to do their own evaluation related to colorectal cancer screening programs. I'm going to talk a little bit about the toolkit itself, and then I will be turning it over to Amanda, who will go into some of the material in greater depth. So the evaluation toolkit is a comprehensive overview of how to conduct an evaluation. We're going to give about a 25-minute overview of the toolkit, including some of the basic content and highlighting some of the recent updates. So if you have used the toolkit in the past, we've made quite a number of new components and features that you might find helpful. The toolkit was developed for organizations with limited evaluation experience or resources. Anyone with time and interest can develop a basic understanding of evaluation and can do it well. This is really important to us, that we don't believe that you have to be a professional evaluator, although certainly consulting with a professional, someone with a university or another research firm, can be helpful. This is really designed to give programs a fundamental base for starting to do some of this work by themselves. It's intended to be a step-by-step guide to provide programs with the knowledge, tools, and skills needed to plan and carry out an evaluation and to work through it at your own pace. The toolkit includes a number of added features in addition to or to support the step-by-step guides. We have sample tools, including surveys, interviews, and focus group protocols, and consent forms. We have a number of worksheets for tasks such as creating a budget or developing a data collection plan. We have tip sheets, such as guidelines for crafting reports or how to engage stakeholders in your evaluation. We have a number of other resources, such as information about baseline screening data sets. We have case studies, including both real and fictional examples of program evaluations for initiatives to increase colorectal cancer screening rates. And we have a number of recommendations about how to address cultural considerations at every stage of the evaluation process. We tried to make the toolkit appropriate for community partners who may be providing an array of different activities designed to promote colorectal cancer screening. In every version of the toolkit so far, we have focused on the types of programs listed on the left: client reminders, client incentives, one-on-one education, group education, and small media. In this edition of the toolkit, we have added some new interventions, including provider assessment and feedback interventions, provider reminder and recall systems, mass and social media, and a pretty significant focus in this version on policy, systems, and environmental changes. We are trying with this version to have a broader array of programs that represent the ways that providers and community agencies may be working to try to promote colorectal cancer screening rates in their community. With that, I'm going to turn it over to my colleague, Amanda, who's going to walk in more depth through some of the features of the new version.
Thank you for that overview, Cheryl. I'm going to be talking about some of the features of the toolkit that are new this year, and then we'll walk through the overall structure of the toolkit and show some examples of the types of tools and resources that are included. So as Cheryl mentioned, one of the major changes this year is that we've expanded the types of interventions discussed to include policy, systems, and environmental changes, or PSE changes. And we did this because we recognize that partners are increasingly integrating PSE change efforts into their work, in addition to program-level interventions. So as you may know, PSE changes really focus on influencing the broader forces that guide and influence behavior and tend to be longer term, while program interventions tend to be shorter term and focus more directly on individual behavior change. PSE changes include policy changes, or changes in laws, ordinances, and regulations, or smaller scale changes to an organization's rules, mandates, or practices. So some examples related to colorectal cancer screening include required coverage of screening under the Affordable Care Act, or a workplace policy that allows employees to get screened for colorectal cancer during work hours. Systems changes are changes that impact all aspects of an organization, institution, or system. Examples include a statewide program that trains healthcare providers on how to change their policies and practices to increase the number of patients who are referred for colorectal cancer screening, or a clinic that trains its staff on how to create a new system to standardize reminders for patients about receiving colorectal cancer screening. And then there are environmental changes, which are simple or complex changes to the physical environment. An example of an environmental change related to colorectal cancer screening could be a mobile health unit that provides a variety of health services, including initial consultations on colorectal cancer screening to residents in neighborhoods who otherwise may face barriers to screenings. So the difference between program and PSE level interventions can impact how evaluations are designed. And so we've included in this version of the toolkit a number of additional tools, resources, and examples of PSE change interventions. Another new feature that we're excited about this year is the inclusion of information about different screening rate data sets. So in evaluating your colorectal cancer screening program, you may want information about screening rates within your health system or your geographic area or with a specific population. And increasingly, some funding sources are also asking programs to track screening rates. There are a number of existing data sets that you can use to track screening rates. In the appendix of the toolkit this year, we provide an overview of 5 national data sets that provide screening rate calculations. Each summary provides information about how rates are calculated, the populations that are included, and levels of data that can be accessed, and the advantages and disadvantages of each data set. There are also screenshots included that show how to access certain data sets. So the data sets that are included are BRFSS, or the Behavioral Risk Factor Surveillance System, HEDIS, the Healthcare Effectiveness Data and Information Set, Medicare claims data, NHIS, the National Health Interview Survey, and then UDS, the Uniform Data System, which is through the Health Resources and Services Administration. This year, another big addition are case studies, as Cheryl mentioned, of real and fictional programs undertaking evaluation efforts. The case studies highlight the principles and steps of evaluation that we describe in the toolkit and include examples of logic models, evaluation questions, and approaches to data collection. Some of the case studies describe actual evaluations conducted by the programs, and others we've provided some suggestions for how the program might be evaluated, and then others present more of a hybrid of both real and suggested evaluation activities. We'll actually be talking about at least one of these case studies in more depth later in the webinar, but the case studies include a Grand Rounds training program for physician groups across the state of Pennsylvania, a case study of the CRC Screening Improvement Program offered through the Ohio Academy of Family Physicians that targets the system of family medicine practice in Ohio, regulatory improvements under the Affordable Care Act to clarify cost-sharing practices for preventative screenings, and then a policy change program by the New York State Health Department to provide paid time off to employees for cancer screenings that Dr. Heather Dacus will actually be talking about later. And then as you can see, the toolkit also includes 2 programmatic case studies, including a fictionalized account of CRC screening group education at a local church, and a fictional program at a community-based clinic that has been using reminder calls to prompt patients to make an appointment to get screened. And then lastly, in kind of new features, this year's toolkit also includes information about evaluating mass and social media campaigns. Media campaigns have become increasingly popular in recent years, especially with the explosion of the internet and social media. And there are a lot of benefits to both mass and social media campaigns to promote colorectal cancer screening, but there can also be challenges in knowing whether your messaging is reaching the right people or having the intended impact. So the toolkit includes some tips and tools for using evaluation to both design your media campaign as well as evaluate its impact. So that was kind of a summary of the major new features. Now I'll walk you through the overall structure of the toolkit and provide you with some examples of the types of information and resources that are included. For those of you that are familiar with the toolkit, you may recognize these 7 steps to evaluation. For those of you who are new to the toolkit, first of all, welcome. And these 7 steps will really guide you through all phases of the evaluation, from describing your program, to developing an evaluation plan, to collecting data and sharing findings and putting your results to use. So the 7 steps to evaluation illustrated on this slide include Step 1, describing and mapping your program. Step 2, prioritizing your evaluation result or questions. Step 3, designing the evaluation. Step 4, identifying or developing data collection instruments. Step 5, collecting the data. Step 6, organizing and analyzing information. And step 7 is sharing and using evaluation results. So for the remainder of my portion of the webinar, we'll highlight some unique features of the toolkit within each phase of the evaluation. Before we move into step 1, I also just want to note that throughout the toolkit we feature 3 fictional programs and follow them as they complete each stage of the evaluation. These sample programs are in addition to the case studies that I mentioned earlier and are really integrated throughout the toolkit to provide additional context and examples of how evaluation can be accomplished for different types of programs. So the sample programs are the Northside Medical Clinic, which is a small clinic with limited evaluation resources that's embarking on an effort to track screening rates. There's the Metropolitan Colon Cancer Collaborative, an advocacy organization that's interested in evaluating their small media campaign. And then the Wellness Clinic, a hospital-based clinic interested in learning about patient satisfaction with one-on-one educational sessions. So here's an example of what the sample programs look like in the toolkit. And again, these are kind of followed through each phase of the evaluation. So now we begin with step 1. When you decide to implement an intervention to increase colorectal cancer screening, your stakeholders may ask why your organization is using a particular approach or why you expect an intervention to be effective. To answer these questions, it can help to have a concise and accurate way to explain what you do, what you expect to happen, and how it should lead to the intended results or benefits. Describing and mapping your program can help others make sense of your intervention, but it also really makes it easier to choose the most appropriate results to measure in your evaluation. So we see it as a critical first step. And the toolkit provides a number of tools to help you map your program, either through a logic model or a program theory. Here's 2 resources, for example, that will help guide you step by step in developing a logic model. And of course, sample logic models are included throughout the toolkit. Here's an example of a logic model from one of the case studies about the paid time off policy for screening that Heather will be talking about later in the webinar. The next step is to prioritize what you want to know from the evaluation. So the toolkit describes 3 different types of evaluation, including outcome evaluations, which look at program impact, process evaluations, which can help you understand how your intervention works and whether it's working the way you expect, and then satisfaction evaluations, which can help you learn about how participants felt about the program or the materials that you developed. We've also included some information about designing an evaluation to assess community needs, which may be used before you even develop your intervention. And so the toolkit will help you think through which of these types of evaluations to use for your specific program. Related to that, we've also included information about how to engage stakeholders in all phases of the evaluation, beginning with deciding what you want to learn from the evaluation and what would be of most interest to your partners and stakeholders, which you can see here on this tip sheet. And then the third phase is to design your evaluation. So the toolkit will guide you in assessing your available resources for evaluation, which includes budget, internal capacity such as skills and resources and staff time, and help you select the most appropriate strategy for gathering information. The toolkit provides several worksheets and tools to help you assess resources you may already have within your organization. So here's a worksheet to help you reflect on your organization's readiness and capacity to carry out an evaluation, as well as identify gaps in skills or resources. And I think Cheryl also mentioned that in some cases it may be beneficial to work with an outside evaluator. So we provided tips for assessing whether that's the right decision for your organization and finding and selecting an external evaluator. And then whether you work with an external evaluator or do the evaluation on your own, the toolkit also will guide you through creating an evaluation budget. We've also included guidance on selecting a method, including the benefits and disadvantages of different methods and cultural considerations when deciding on a method. So the toolkit covers primary data sources, which is information gathered specifically for your evaluation, including surveys, interviews, focus groups, case studies, and in some cases medical record reviews or chart audits if you're collecting new information that's included in these records. The toolkit also provides information about using secondary data sources or data that that's already been collected, such as in medical records or charts. As I mentioned this year, we've also added new information about existing data sets. So you might use these to look at screening rates within your community or compare local rates to statewide or national rates. And then here's an example of a type of information provided in the toolkit about one of the screening rate resources, so BRFSS, which again includes information about how rates are calculated, the populations that are included, and levels of data that can be accessed, as well as advantages and disadvantages of each data set. And then moving on to step 4, which is identifying or developing data collection instruments or questions. The toolkit walks you through the development of new tools, such as writing surveys or focus group questions. It also provides information and links to several existing instruments, and I'll just highlight 2 of those here. The programs often write survey questions in very different ways, which is fine and to be expected, but there are benefits to being able to compare program results nationwide or to work that's been done in previous years. And NCCRT actually suggests including 5 core questions in their evaluation instruments to improve our ability to compare results on a few key measures. So these core questions are also included in the toolkit. And then, as I mentioned, the toolkit also includes a number of other sample tools which you're encouraged to use and adapt for your program. One resource that's new this year is several sample tools that were used to evaluate the Links of Care program through NCCRT. So for those of you not familiar, the Links of Care program provided funding and technical assistance to community health centers to improve colorectal cancer screening and follow-up care for uninsured and underinsured patients by strengthening relationships with the surrounding medical facilities and resources in the community. So the sample instruments that are included in the toolkit include tracking tools and interview guides that were used to assess the implementation and outcomes of the program that, again, you can certainly use or adapt for your own program. And then here again are some examples of other resources included in the toolkit. A sample focus group protocol, the 5 core questions you can see on the left there, although I think you can only see 3 on the screen, and then some tips on writing strong surveys. And then the next evaluation phase is to actually collect data. The toolkit provides information on staffing and budgetary considerations, along with determining who your participants will be. It also includes guidance on determining when to collect data and how often. For example, you might want to do a pre- and post survey, or you might just want to interview participants after the program has been completed. Information about confidentiality, anonymity, and common data collection challenges is also included in the toolkit. And again, here are some more examples of resources that are jam-packed in the toolkit, including a worksheet to help you develop a data collection plan, a sample consent form, and tips for conducting a focus group. And then step 6 is to sort and analyze your data. So the toolkit provides information and resources on conducting quantitative and qualitative data analyses, and also offers suggestions and things to consider in the analysis and interpretation of your findings. So again, here are some tip sheets about entering and managing data, as well as conducting quantitative analyses that may help you at that phase. And then the final step in evaluation is to put your results to use. So this section will help you consider the information needs of your different audiences who would benefit from learning from your evaluation, and provides tips for selecting the right communication strategy, preparing evaluation reports, and communicating your findings effectively. We've also included some reflection questions to help you and your key stakeholders think about the implications of your findings, such as what outcomes show the highest success rates? What parts of the intervention do you think contributed most to these outcomes? Did the program or policy change impact the people it was intended to? And then sort of a process evaluation question, what challenges emerged during the implementation of the evaluation plan? And should the evaluation design be revised to minimize some of these challenges? And then here again are some examples of worksheets and tip sheets that are available in the appendix. These worksheets are designed to help you think through the implications of your findings and develop an action plan based on what you learn. And again, there's also some tips here for writing the report. So that is a brief summary of everything that's included in the toolkit, or a lot of the resources that are included in the toolkit. The full toolkit is available here at this link. And then I just want to also highlight a few additional resources that are available on the NCCRT website, including several other webinars related to evaluation and a tip sheet that we worked on with NCCRT this year about evaluating communications campaigns as part of your 80% by 2018 efforts. So with that, I'm going to turn it over to Heather Dacus, and again, we'll be available for questions at the end too.
Great. Thank you so much, Amanda and Cheryl. And thanks very much to the National Colorectal Cancer Roundtable for the opportunity to share information about the project that we've been undertaking over the last few years here in New York State, to be both part of the toolkit and to share the information today on this webinar. Before I move ahead, I do want to give some thanks to 2 key staff here at the New York State Department of Health, Gina O'Sullivan and Suzanne Kiwan, who were really quite key to this effort and continue to be. So let me tell you briefly about the intervention that this evaluation approach centers around and the information that you'll find in the toolkit under our case study. So from 2013 to 2015, the New York State Department of Health funded the Broome County and Schenectady County Health Departments to implement 3 cancer prevention policy interventions. And one of those 3 interventions is listed here on this slide and centers around paid time off for cancer screening. So the objective was that by September of 2015, at least one municipality in each of these counties would expand an existing state paid time off policy for their employees to include colorectal and cervical cancer screening. So to describe this intervention a little bit further, to understand how we got to this point, and to better describe the intervention overall, we've learned a lot from colleagues in our tobacco control world that policy and environmental change interventions can promote health and support healthy behaviors. We also know from some research that lack of paid time off is a potential barrier to people going out to obtain recommended cancer screening. In New York State, it's very interesting that we've had on the books for quite some time a New York State law that provides public employees with 4 hours of time off for breast cancer screening. So in other words, women who work or are employed by New York State cannot charge their own sick time, but take 4 hours of time off to go get screened for breast cancer. We also knew that local municipalities have the ability, if they're interested, to expand on existing state law, in this case to include paid time off for other cancer screenings, most importantly colorectal cancer and cervical cancer. And we wanted to approach it in this way from a local perspective in lieu of efforts that have been underway for quite some time to expand the state law, which again have been attempted but have been unsuccessful to date. So the general logic model for our program really stems from this slide here. This is a visual description of the theory of change behind a policy intervention. So the demonstration contractors that we funded really started to work at the left side of the arrow here, and their scope of work really focused on both public as well as decision-maker education. And we theorized that program activities would lead to desired changes along this pathway such that awareness and beliefs about the issue would change, support for policies would increase, and that hopefully there would be some will for policy adoption. To build support for policy change, of course, the 2 demonstration contractors were provided with training and technical assistance over the 2-year contract period to employ these 4 strategies shown on this slide: mobilizing and empowering communities, educating and engaging communities, engaging organizational decision makers, and educating government decision makers, all in the hopes that this work would lead to, again, the community supportive of policy change. So now that I've described the program and shown you how we ended up creating a map or a logic model of our work, we wanted to also move ahead to prioritize our evaluation questions, design the evaluation, create tools for gathering the information, and of course train the 2 contractors on how to use the tools we created to submit the information of interest. So our process-related questions and measures are shown here, and were really developed to help determine the inputs, activities, and outputs involved in the policy implementation process. So for example, the first question, what activities support policy implementation? We were interested in knowing the answer to this question, so we determined and built contractor work plans around these efforts so that we could quantify specific things like the number of community education events that took place, the amount of earned media that was generated, and other examples are listed here on this slide. Along the way, we also wanted to determine if we could measure public support for the policies that were involved in this project as a reflection of efforts around community education, and also to see if we could garner information for the contractors to use in helping to educate government and organizational decision makers, who of course were the end decision makers on whether or not a policy was going to be adopted. And we were able to work with Siena College Research Institute to conduct a targeted telephone-based public opinion poll in each of these counties in year 2 of the project. And we did learn, I'll share the brief results related to this policy, that over 80% of residents from these 2 pilot project counties were in favor of policies that would require employers to offer employees paid time off for cancer screening. So with that information, contractors really had the ability to go out and share those results with the folks who could make the decisions in the end. And of course, we wanted to measure short-term outcome measures to better understand the impact and potential reach of the policy intervention work. So our 3 key questions and related measures were: how many sites adopted a paid time off policy for screening, how many people would potentially be affected by the policy, how has the policy impacted employee screening behavior. We used an evaluation design that included a mixed methods of data collection, and this slide outlines the data sources that were used. All provided both quantitative and qualitative information to answer the evaluation questions of interest. The first 3 listed here really help to inform the process measures as well as the short-term outcomes related to policy adoption. The telephone survey I already mentioned was helpful to inform the community education question. And then finally, the payroll, personnel, and human resources records within municipalities in these counties help to answer questions related to the short-term outcomes of reach and potential impact of the policy. So it could provide a lot more information on the results of the project overall, but in the interest of time, I've kept just a couple of key summary points about what we learned as it relates specifically to the paid time off element of this policy intervention. So by the date by which we wanted the contractors to achieve this goal, 1 municipality in each county did adopt and implement an expanded time off policy for employees to obtain colorectal cancer screening, as well as cervical cancer. I should have that here on the slide, with a potential reach of about 3,500 employees. Payroll data in 1 county, just over 1 year's time, showed that the paid leave policy use tripled. And these 2 counties actually continued to promote the expanded benefit to eligible employees. So it's not even so much that there's a policy implemented, but you want to make sure people know that the policy exists so they can take advantage of it. So these counties are regularly promoting the policy and are working with their HR departments to track use. And because of the findings from this demonstration project, we have been able to expand this work to 28 contractors statewide, which is fantastic. And also the work does not just impact municipalities, but employers of all types. And as of this past fall, 8 municipalities and 5 organizations across the state amongst these 28 new contractors have adopted or expanded paid leave for cancer screening, and we continue to see more organizations and municipalities get on board. So just my final slide, we've made efforts to use what we've learned to share our information with other programs, to inform our own work, to inform leadership here at the New York State Department of Health about the importance of this program and policy work in general. And it's great to be able to share these results with all of you. If people have any questions about our work, we'd be happy to answer them either on this webinar or separately via email. I will now turn it over to my colleague, Heather Brandt. So Heather, I am bringing the ball to you.
Great, thank you so much. Thank you all for that excellent introduction. One of the things over time that we've realized that may be useful for people who are users of the toolkit, particularly community users, is to provide them with some basic advice, because we realize that the level of sophistication of many of the evaluation tools that we share, and the last example as well, reflect a different level sometimes of evaluation capacity, but that's not intended to make evaluation seem intimidating or overwhelming. We want evaluation to be something that anyone who's doing work in this area or any area would feel comfortable coming up with plans, designing, and implementing. So I'm going to run through a few of the pieces of advice that we have collectively developed as a task force and in our work with Wilder on the Toolkit. So first off, evaluation in community settings, as I mentioned, can seem to be a bit daunting, but you don't always have somebody on the team who is an evaluation expert. Maybe you don't have an existing connection to an academic institution or a nonprofit organization that's doing evaluation. Maybe there's no one on your team who's ever had any experience with evaluation. Sometimes you're so focused on doing the good work that is needed to be done in order to increase participation in screening, getting people interested, addressing policy, system, environmental level factors that have to be in place to make it easy for people to get screened, that evaluation is not always a priority. And most of the time, evaluation gets thought about when it's close to due or even after you've started doing. And it's something that I think is really important to keep in mind is that evaluation is not always about the numbers. And I'm going to share some examples of how you can collect evaluation data consistent with the recommendations in the toolkit following the case studies and examples provided. And you can also add in some other tools to help you capture the important work that you're doing and the results of that work. So the toolkit is a great resource for you to refer to. So initial steps are really focused on the design phase of the 7 steps that are reflected in the evaluation toolkit. And during that design phase, you want to start thinking about who is at the table. Do you have the right people at the table for your effort, whatever that's going to be? And in community settings, that may be some sort of community event to raise awareness. It may be an advocacy event to talk to legislators or other elected officials about needed policy change. It could be a number of different strategies being undertaken in a community setting. And so figuring out who's at the table and documenting who's a part of the team and who else should be a part of the team is an important initial step. Take a look at what data are available to you. This can be the most intimidating part of this process, in my experience in working with community groups on evaluation. So earlier you saw a slide with 5 data sources for colorectal cancer screening. There's the CDC BRFSS data, Behavioral Risk Factor Surveillance System, BRFSS, which is an annual survey conducted throughout the United States and some of the U.S. territories, and some of the questions on that survey are related to or are about, colorectal cancer screening. So that's a great place to go take a look and see what the estimates are for your state. You can just go to Google, type in CDC, BRFSS, and the data summary options will come up. HEDIS data, another data source that gets reported on an annual basis for you to be able to go take a look at colorectal cancer screening rates. This is a different type of data. It's not a survey. Medicare data, which are claims data based on the number of claims submitted for colorectal cancer screening. NHIS, which is the National Health Interview Survey. These are in-depth surveys, meetings with people, review of medical records to really determine a true baseline, a true rate for colorectal cancer screening. And lastly, UDS data, or Uniform Data Systems data, reported by federally qualified health centers or community health centers. So there's a number of different sources that already exist where you can go and get an estimate of the current colorectal cancer screening rate. Maybe there are other places you can go. Maybe you can talk to a health department contact, a physician's office, a community health center, a hospital. there's a lot of places that may have existing data about colorectal cancer screening in your community. And I recommend trying to collect more than just from one place. Get a round of estimates from different folks about the level of colorectal cancer screening. And then sometimes there are data that we would like, and I know those of us presenting today have talked a lot about data that we would like to have, and perhaps many of you have that experience as well. So what data are needed? And start asking around. Maybe those data do exist as well, or you can work to collect those data through your efforts. Try to select a measure or more than one, and by measure we mean select an item, a question, something that you want to see change as a result of what you're going to do in your study. So we ideally would like to see colorectal cancer screening participation increase from beginning before you started to the end. But perhaps there are other things that you're looking to change, such as increasing awareness, increasing knowledge, increasing people's confidence in their ability to get screened. There are a number of different measures that you can select, and you can select more than one and monitor those. Take stock of what's been done in your community before. So this is where getting to know stakeholders who have a vested interest in colorectal cancer screening, and unless you've had your colon removed, everybody in your community has a colon, so somehow, in some way, colorectal cancer screening should be of interest to people. And so learn about what's been done in the past and take inventory of that and think about how you can build on those efforts. And if nothing's been done in the past, well, you're starting out with a clean slate. So start from there and move forward. You don't have to do everything at once. So these initial steps are going to help you get a baseline for your activities. And if you want to know if you've made a difference, you have to know where you started. So you have to have some baseline understanding of what's been done in the past and what are the current rates, what are the current measures that are available in order to know if you've made a difference. So some pieces of advice about how to know if you reached the next level. So in other words, did you make a difference, yes or no, and why or why not? Did you or did you not make a difference? These are the real outcome questions that you want to answer. And you can use process measures to monitor your progress. So how many people were engaged, so you can keep track of the number of events that are held, the type of events, the location of the events, the number of people who attended, who did attend, what was the composition of people like who attended, how many brochures did you give out, how many fit kits were given out, how many people decided to talk to a healthcare professional to learn more, what types of questions were asked. Those are all process style measures that can be collected. But if you're going to be engaging in these efforts in community settings, it's also really important that we tell the story of colorectal cancer screening. So you can engage survivors, engage people who have loved ones who have had or have colorectal cancer or perhaps even died of colorectal cancer in using stories, photos, videos. You can have a big board that lets people write inspiring messages. There's just a number of different ways that you can learn more and measure things that are happening at your event in community settings. Of course, you can also administer some of the data collection tools that were shared earlier, including surveys, interviews, focus groups. You can use community events at different places to engage people in more in-depth involvement in some way. You can also use that to find new stakeholders. Those are all outcomes of these different activities. And so when you're using the toolkit and these other resources, don't feel constrained if you have a new or different idea that will complement some of these recommended approaches for how to do that. That provides you with the blueprint, and you can embellish along the way that really capture the story of the efforts that you're engaging in. Tracking the colorectal cancer screening rate, that's the ideal measure. As I've mentioned, you can monitor that and look to see if you've made a difference, recognizing that depending on your data source, there may be some limitations for how well you're able to track that. That's why you're also encouraged to think about, in addition to screening, what might be other measures that you might want to track. Know that it takes time. You don't always see immediate impact. And make sure you're sharing your progress. In the last example that was shared about monitoring progress and showing the impact, and really there was an approach of engagement and empowerment with people in the community. And the great news is if you can get people interested in colorectal cancer screening, you can make improvements in that particular issue, but hopefully keep people engaged and think about where there are other opportunities in the community to make a difference. So the advice that we've provided here is pretty simple, but it's just meant to give perspective to the very detailed approach that's outlined in the new version of the toolkit, which of course includes these new examples. And so keep that in mind as you're coming up with your approach to evaluation. Keep it manageable. Don't feel those feelings of overwhelm. Ask for help. Perhaps there's some way to connect you to someone who has evaluation expertise if that's not something you have on your team. But at the same time, take advantage of these existing resources like the toolkit that's out there, because it really does provide a very easy-to-use guide for how to monitor the impact of the great work that's being done in community settings. I'm going to turn things back over to Andy now to talk about patient navigation work.
Great, thank you, Heather. So everyone has spoken a bit about the contributions to the toolkit, and I think one of the exciting features that's come forward is also really thinking about sample navigation evaluation tools. And this is a complement to some of the work that the roundtable is invested in, which we'll talk a little bit later. But we're really excited in terms of being able to offer, from a variety of approaches, and I know navigation is really something that's quite popular in terms of thinking about specific interventions, and people are really thinking about the evaluation metrics to show sustainability and value. So I'd like to share quickly a couple of the tools that have been actually linked to the new evaluation toolkit edition. And so Heather, I'll have you, if you haven't passed yet, I'm not sure, if I'll have you just even advance to the next slide for me, if you don't mind. Oh, there we go. There I am. Okay, great. So just a quick note that when we're really talking about evaluation of patient navigation, a lot of the real work hinges around outcome data related to valve preparation quality, show rates, as well as the ability to reach CCAM. But part of the actual real test of this evaluation is working is also really based on the experience of the patient and person who is being navigated. And so through the efforts of the Colorado Colorectal Screening Program, and I know other state and national programs have really looked, including CRC about evaluation of navigation, we've included some fantastic tools based on what's been working in the field. And here you can see specifically one of the navigation satisfaction tools that's been circulated in Colorado. And this typically is provided for people who are navigated through the CCSP program on a every year or every other year basis to really think about what is the impact that navigation has had on the overall patient experience. And as noted here, you can see that we're really talking about explaining the education, helping with the logistical as well as psychological barriers, and really ultimately understanding what sort of resources were available and what programs did to augment the experience for patients. So you can see that this really gives a stratified example of all the different domains and really getting that input, which really shows ultimately the patient experience. In addition, we've actually included this specific strategy and sample in Spanish. Is right now 30% of the people who are navigated through our statewide program are Spanish-speaking, or excuse me, Hispanic, and I think of that, at least half of the group are monolingual Spanish speakers. So we're really excited about, again, to all the examples that have been shared today, the real-world and real-life experience and the different types of tools that are really helping augment all kinds of interventions. In addition, in the toolkit, we've also included some specific outcome data collection forms, particularly in Excel format, so that they can be really utilized, downloaded, or integrated into the work that all of you might be doing within your clinic systems, or just fields for just general thought as you think about integration into the electronic health records, as well as other types of process programs that you're using to help evaluate, as I think that these tools really should be adapted to really think about the common domains and metrics that we are trying to capture. So as noted at the initial onset of the discussion of evaluation, in addition to the satisfaction and the patient experience, a lot of the great work around prep quality, speak and reach, that education, outreach, appointments and attendance, these are really great things that we need to monitor throughout the course to show the fantastic outcomes and impacts that our programs are making in terms of integration of patient navigation programs. So we're really excited to showcase this within the new evaluation toolkit, and I got to tell you, Amanda and Cheryl, I really like that new sticker. It just makes it stand out. So super excited that these are some of the new tools that are being featured in addition to showcasing a lot of the case studies that are available as well. I'd also like to just mention that in terms of really looking at the complement noted around to what National Colorectal Roundtable has made in terms of navigation is really looking at sustainability of navigation within different settings and how do we help directly pay for, sustain, and show the value of this work. And I bring this example forth because I think that we've talked, and I think there's a lot of thematic around evaluation, is that if we really show it works and evaluate it from, I think Heather and others mentioned at the outset, and think about what we're trying to prove, how we're trying to show value, what resources we need, how do we draw in champions and decision makers, we have to think about this ahead of time and really, as much as we can, evaluate and think about these sort of domains that we want to collect and really be thinking critically about who are the people we're trying to show improvement, whether it's basic data or there's a specific question as noted throughout the course of this evaluation webinar that we're really trying to answer. So I can bring this forward in that the toolkit lives, the Paying for Navigation toolkit lives where the evaluation toolkit lives as well, with all kinds of other beautiful toolkit examples. But one of the things that I just wanted to mention is that when we really consider the content of the navigation toolkit for sustainability, we see the experience of a number of state, regional, as well as city-based programs that implement navigation. We talk about the evidence base, but then further go into quality and accreditation measures, thinking about the economic evaluation policy strategies, and there's a specific strategy connected to evaluation metrics that I'd just like to say a little bit about. Ultimately, in our evaluation toolkit, as noted even with the tools that are noted in the evaluation toolkit in the sustainability toolkit, we still continue talking about common threads of evaluation: valve preparation, show rates, exam quality, patient satisfaction, timeliness. This is all the information that we're going to need to ultimately, throughout what I've noted in all those other chapters of the sustainability toolkit, help us monitor data for grants and proposals and making requests for payment and resources to show or sustain our programs. We need to show the impact that they're making, the cost analysis, return on investment, and the like. Really also very much rely on much of the basic evaluation and outcomes around patient satisfaction and all the elements that were featured in those couple of documents that I showed as examples of how do we really gather information. And a lot of this can really be done fairly easily at the outset and integrated into many of our tools as we consider making policy changes, shifts around, specifically around navigation. We really have to fundamentally start with the evaluation metrics, and again, building on the 7 fundamental steps that Cheryl and team spoke of, as well as everyone exemplified through their interventions. Navigation is one of those that we really can follow some of the same strategies and think about the common metrics. So within the toolkit for sustainability, we really delve into how to get there, either with relying on the information that you have in-house, or even thinking about how do you make good partnerships to evaluate so you can ultimately help sustain programs and services as it relates to patient navigation. So we're super excited that the evaluation toolkit as well as the sustainability toolkit are really complementing each other in terms of the work that we're presenting. So we brought that as a very, very new addition, as we know that there's thousands of folks who are really struggling with an intervention that we know works, as proven outcomes, but we don't want it to be an anecdote. We really want to continue to show that evidence and build that and super excited that the roundtable is very committed to helping us with this sort of work around navigation and evaluation. So with that, I want to go ahead and I think, Mary, I'm going to kick it over to you as before we go to the question and answer session, because I do know we want to say special thanks, of course, to Amanda Hain and Cheryl Hansen for all of their great work. And I know that Cheryl's particularly been with us for years helping develop this toolkit, and I think it stands for itself about what an amazing tool that it's been. And I also want to say a special thanks to April Berry, who came on as our new co-chair of the overall measurement and evaluation task group. And then, of course, with Heather Brandt and Ann Zauber's work in evaluating specifically the 80% campaign, it's fantastic. But also to Tamar Wallace, who's given a considerable amount of time, who just actually retired as our co-chair from the group just about a year ago. So just a huge thanks. And then, of course, to Mary and team and on all the roundtable work. So Mary, I understand, I believe, that we also, and I'll punch to you really quickly as we close out this webinar, there's an additional information slide about an upcoming webinar that you wanted to just say a quick shout out.
Yeah, if you want to pass the ball to me, I'll flip there. But as we announced in the webinar or in the email, we did ask our presenters to stay until 3:15 to answer any questions. So we did get a few in, and I see Heather answered one in the chat function, but it's such a good question, I think it's worth punting to Heather again. So someone asked, made an excellent comment, BRFSS data are usually available and analyzed at the state level, with only some states, counties having sufficient sample size to provide county-specific data. Do you recommend CRC mortality data available on county level as substitute? And I believe you touched on this when you spoke, but if you don't mind answering that for the group, Heather, I think it's an issue everyone struggles with.
Yeah, that's a great question. There's been lots of energy spent through the roundtable in the last few years on the best way to get small area estimates of screening incidence and mortality data, because it is a challenge in our current system. For BRFSS data or BRFSS data, that's the CDC survey data that are collected annually. Within each of the states and U.S. territories, there's a designated entity that manages that survey process. Usually it's the central health department in a state. It's not always. There are some other entities within a state that sometimes manage that. My first call would be to try to figure out who that is. I believe on the BRFSS website, I was trying to mess around and figure that out. The CDC has a list of who's managing the process in the state, so you should be able to find that. And I would find out if there are county-level estimates. We know as we get to smaller units that sometimes the estimates aren't as reliable as we would like, but it can at least, for these purposes, give us some sense of what the screening rates look like. So that would be one strategy. In terms of using incidence and mortality data, those data can be very useful to draw attention to the need for a focus on colorectal cancer screening. If we want to try to save lives, we need more screening. And so that can be a good tool to use. Incidence and mortality data takes several years to move. Those tend not to move very quickly, so they become sort of a useful indicator, if you will, of the status of an issue and can help in drawing attention, I would say.
Okay, great. Thanks for that excellent response. And let me invite folks who do have time to stay on. I know not everyone can, but you are welcome to enter some questions in the chat function. Go ahead.
Mary, just quickly, Heather and I know both Heather Brandt and Heather Dacus, I believe Heather Dacus has a time frame, but Heather Brandt, you brought up a comment that I thought was helpful, and I've alluded to it as well, but both Heather Brandt and Heather Dacus, I think, being from state health agencies as well as from School of Public Health, when we talk about community agencies really aspiring to help reach out and collect data that they might not have or otherwise be able to collect or analyze independently, from state health departments and schools of public health, what are we able to do in terms of being state-based entities for community. Heather Brandt, would you like to respond first?
Sure. So I think that the answer is different depending on the setting. The Arnold School of Public Health at the University of South Carolina is the only school of public health in our state, and so we work very closely with state agencies, including the South Carolina Department of Health and Environmental Control, our state comprehensive cancer coalition, the South Carolina Cancer Alliance, other nonprofits, especially national nonprofits like the American Cancer Society that have a presence in our state, and other organizations and groups as well. And so if you, in my state, because it's a smaller state and a smaller space, if you talk to one of us in those agencies, you're likely to open up a whole network of connections. We're constantly referring folks in the community who have an interest with other colleagues who may be able to connect with them with someone locally. And so I think if we're not able to help directly, asking us and letting us help you through our networks is another bonus of reaching out. So we're able to do that. I know that's not the case everywhere.
Great, thanks, Heather.
Heather Dacus, what about being at a state health department? Any specific words of advice for community or people in the field?
Yeah, I think, depending on what state you're in, you might have a well-equipped city health department somewhere or a state health department. Even local health departments, some have a lot of capacity and can provide community organizations with some existing resources, or, connect them to people who have the right resources to assist with evaluating, or, to ask questions about what data might be available. I know here in New York State, we try to get information out to our local health departments, have webinars to provide information out to partners. Through the work we do with our contractors and partners, we really ask them to share information out with their partners in local areas. But I'm sure we could all do a better job of doing this work. But I guess I would suggest for folks to reach out to their chronic disease units, look at the websites for your state health department or your city health department and see what exists around chronic disease and cancer, and then see if you can find a contact within. I'm sure you can find someone who would want to help answer questions that you might have at the local community level.
Great.
Well, good. Well, I don't see too many other questions coming into the Q&A function, so I would just like to thank all our presenters, and particularly Cheryl Holm-Hansen and Amanda Hain, who just put so much into this. I think until I've been working with them on this for months, but until you actually see everything presented, the amount of resources that they've compiled into one spot is just phenomenal. So congratulations to you both, and many thanks to the Heathers and to Andy for just doing an excellent job bringing some of these resources to life with your very practical, real-world examples. I know everyone appreciates when we can make some of this information real, so many thanks. So last bit of housekeeping, we will be sending around a replay of the webinar to all participants, as well as an evaluation link. So please take a minute. It's a very brief survey. It helps us improve our webinars and other trainings that the NCCRT offers. So, so if you could take a moment to fill that out, we'd appreciate it. And other than that, really appreciate everyone's help and time, and have a great rest of your day.
Thank you.
Bye.